Being live streamed. Okay, cool.
We are
So
live.
we are live. Okay, so let me just for those of us joining us, those of you joining us early, thank you very much. Let me just what I'm going to do is just going to put the link. It looks like I can't give the link on both Facebook and YouTube at the same time. So let me actually just put a message for people there. And Renae, on your side, can you see if things are going live on your end?
All I can see at the top of the Zoom is that it says that we're live, and I just got like a little notice that we're live. I can't see people like
Perfect.
joining or anything like that.
Oh, no, I mean, like if you go on YouTube on your end.
Let's have a look.
Perfect. Okay.
Nope, it still says upcoming on YouTube. It is not currently live.
Okay. All right. Well, just in case people can see us, give us a shout out and see. Let's see here.
Let me see about Facebook. It's live on Facebook. I can see
It's
that
live
one.
on, you can see it's live on Facebook.
Mm-hmm.
Oh, okay.
There's a slight delay, but it's live.
Oh, there we go. Okay. Okay, very cool. Well, we got Facebook at least. And let's see if we're gonna actually go on YouTube. So streaming. Okay, good. So we're streaming both. Okay. All right. Well, thanks for joining us, Dr. Thomas. This is my name is Nathan Gershfeld. This is Dr. Renae Thomas. We're with Fasting Escape, and we're going to do a Q&A today with some people. Now, I've sent out the newsletter, and some of you wrote down a number of really good questions. So we're going to go over some questions. And I realize at Pacific time, this is kind of in the middle of the day for many people. So just in case you aren't tuned in right away, and you can't, we don't have your answers, or you can't type in some questions, email them to me later. Next time we do another one, we'll answer those questions. And then we've also got other questions that people have emailed in as well. And so really appreciate everybody joining. So, all right. Well, Dr. Thomas, before we start, do you want to tell us a little bit about yourself? I know many of our listeners, many of our people on my newsletter kind of have been introduced to you through the newsletter. You're now our medical director. You've been on Chef AJ a couple of times, so they know a little bit about your background. But give us a little bit about yourself.
Yeah, a little blurb. So Dr. Renae Thomas, super excited to be have joined Fasting Escape at the beginning of the year as medical director. I'm triple board certified physician. So I did family medicine, general preventive medicine, and public health and lifestyle medicine. And really just coming on to add that extra level to Fasting Escape for more medically complicated cases, people on medications, and people just looking for a lifestyle focused or plant-based doctor. So really excited to be here.
Excellent. All right. Well, we're glad to have you. And let's just actually, I'm not one for a lot of small talk, so I just say we go straight into the questions and then go from there. So our first question has to do with salivary stones in the parotid glands. So the question is, can fasting help in the body disintegrating any salivary stones in the parotid glands? If yes, how long, and which foods while refeeding? So in terms of fasting, so what we do at Fasting Escape is I help people go through a supervised, safe, and effective water-only fast, or we do a modified fast. And there's a number of different conditions that respond well to this. Because of the research of my mentor, Dr. Alan Goldhammer, and his team at True North Health Center, there's been a number of research that's been done on a lot of different conditions, particularly high blood pressure, things like autoimmune diseases, type 2 diabetes. Salivary stones, there isn't a lot of research on it, but so the rest is just clinical experience. So yes, I have seen salivary stones the symptoms of salivary stone may sometimes dissolve during a fast and even a healthy diet. So in principle, yes, it can. There may be enough autophagy going on that a salivary stone can dissolve. It's hard to say because we do require longer term follow-up and a longer term fast for that. How about you, Dr. Thomas? What's your thoughts on it?
Yeah, so salivary stones, just for those that don't know, they're these little small stones that can form in the glands of the mouth, and they tend to block the flow of saliva, and they can cause a bit of pain or discomfort. They're called sialoliths, medically speaking, and if they get blocked and cause problems, sialolithiasis. We like to add lithiasis or iasis to pretty much every medical condition. Usually they do respond well to conservative treatment. So meaning they don't typically need medications, they don't typically need surgeries. And we usually start with applying just, moist heat, gentle massage. Obviously these things can be done while fasting, and staying really well hydrated is important. Now, if you're not fasting, sometimes having some lemon juice or something tart can stimulate saliva to, to produce a bit more saliva, which can help them pass. But I agree, basically what you said. I think that, being in a rested state, optimizing the body state of healing, combining that with staying well hydrated is probably a good recipe for helping to move those saliva stones for sure.
Great, thank you. Okay, our next question is has to do with a little bit of your area of expertise, Dr. Thomas, and this is PCOS. So this was a question that was sent in by email. The question is, I have lean PCOS. I got diagnosed 2 years back. My diet is predominantly vegetarian, so lentils and roti, Indian flatbread with vegetables, and a good amounts of fruits and dairy in the form of milk and yogurt. Is there any evidence that water fasting benefiting this medical condition, since I haven't started the over-the-counter pill treatment for PCOS? Also, my periods get significantly and evidently irregular during stress. Maybe there's a psychohormonal interaction basis for that as well. Well, Dr. Thomas, how about this is something that I see very often when people are when women in particular are having irregular cycles or heavy bleeding. One of the things that they're going to be tested for is some sort of fibroids or PCOS or some sort of hormonal imbalances. And with fasting, what we typically see is what we're seeing is body's incredible ability to rebalance hormones and other things. And so typically with some type of cysts or growths, it can take a longer fast. But I actually just recently talked to a patient of mine who did a short fast, and even still her cysts shrunk. Maybe not all of them, but small ones shrunk pretty well. We had a pre and post ultrasound. And so, yeah, we typically just let the body heal itself. Now, there's a lot of dietary considerations, especially in this particular question, that are important. And so, Dr. Thomas, I'll let you wind out on it. But that's what I've seen with fasting is I don't think I've seen evidence in terms of research studies. I think there are certain markers that go down when you do a water fast. And so those are interesting to note. But I don't think I've seen any PCOS and water fasting studies published, but maybe that'd be fun to do in the future.
Absolutely. Should we do a bit of a deep dive on PCOS? And the reason I say that is because it's really common. It's actually about up to 10% of women struggle with PCOS, and it's not a fun time. I want to always say you're not alone. It's a very common hormonal abnormality in reproductive age women, like I said, up to 10%. Do we want to do a bit of a deep dive into what it is? And
yes.
So if we understand what PCOS is, sometimes that's helpful to then understand how diet and fasting can kind of help out. So the first thing to do is actually diagnose it. So often it's misdiagnosed, underdiagnosed, sometimes even overdiagnosed. So being diagnosed with lean PCOS is an interesting one, because a lot of women, when they're lean, I'm assuming they mean lean in terms of their body weight. They're not overweight, which commonly goes with PCOS. It can be even more difficult to diagnose PCOS. So I always go over the criteria. So PCOS has meeting 2 of 3 criteria. So irregular menstruation and typically anovulation, meaning you're not ovulating. That's why the cycle becomes irregular a lot of the time. So number 1 is just your periods are irregular. They're not coming at a regular time frame, which would typically be, around that 4-week mark. The second thing would be that you have some evidence of elevated androgens. So androgens are your testosterone, androstenedione. These are so hard to pronounce. DHEA and DHEAS. That would be on a lab test, or you have symptoms of having high androgens. So that often is dark hair on the face, on the chest, on the back. So hirsutism, maybe having very oily skin and acne, breast atrophy sometimes, excessive muscle mass, or male pattern hair loss. So sometimes we diagnose it if the symptoms are very obvious and or doing the blood tests. And the androgens become increased with PCOS because of the high levels of LH, or luteinizing hormone. And then also we have high levels of insulin seen with PCOS. So other things you want to be testing is your FSH and LSH, and then as well your insulin levels and your blood glucose. The third criteria is that you have to have polycystic ovaries, hence the name. So on imaging, which is typically an ultrasound, you have to have at least 12 or more follicles, and they have to measure 2 to 9 millimeters. So very specific criteria. It's not just that you have a couple of extra follicles or something like that. And typically one or both of the ovaries is enlarged as well. So over 10 milliliters, that has been at least one of them. So if you meet all that criteria, that would be that you do have the diagnosis of PCOS. And so the cause of it, unfortunately, is not completely understood, but it is essentially an endocrine or a hormone disorder. And it's affected by a lot of things: genetics, metabolic system, your endocrine system, and actually environmental influence, which is really where we come in, because environment includes obviously our multi-day exposure of the foods we eat, the water we drink, and how we live our lifestyle, how much we exercise, and how much we stress. So with regards then to the reproductive system, there's abnormal levels of the pituitary hormone LH, or luteinizing hormone, and then we have high levels of male hormones or androgens, and they interfere with the normal functions of the ovaries. So to explain how these hormones then cause symptoms, I usually explain, and I think it might be helpful to quickly overview here, sorry to all our men, but how the menstrual cycle works, right? So normally, day one, first day of your menstrual period, nice and easy. Then you start your follicular phase. It's 10 to 17 days, and that's when your FSH, or follicle stimulating hormone, starts to be the predominant one. So at birth, your ovaries actually have all of the immature eggs that you'll use without your entire lifespan. FSH is the signal to the ovaries to recruit some of the follicles, and you're going to mature them every month. Each follicle has one egg. The dominant follicle will release the egg at ovulation, and the others become reabsorbed in the body. Unfortunately, they can't be reused. And it's during this time that your amounts of estrogen will stimulate thickening of the lining of the uterus. So that's the endometrium that gets thicker. Your estrogen levels will peak. Then there's a surge in LH that triggers ovulation, and that's usually about 24 hours later. After ovulation, you go into your luteal phase, estrogen declines, progesterone increases, peaks about a week later. That's when, if the egg is fertilized, it will implant. If not, your progesterone levels will fall and you'll begin that menstrual bleed. Again, that will be day one of your cycle. So what happens in PCOS? Why does that process not happen and repeat every month, like in women with a healthier menstrual cycle? And so in PCOS, multiple follicles, they're often small cysts, kind of 4 or 9 millimeters in diameter. They accumulate in the ovary, and none of these small follicles are capable of growing to the size that would trigger ovulation. So as a result, then the estrogen, the progesterone, LH, and FSH levels all become unbalanced, and you start to get the polycystic ovaries because you're getting all these little cysts and follicles that aren't able to mature. Fertility issues obviously is one of the main reasons that this starts to come up, but the hormonal irregularities contribute to things like weight gain, insulin resistance, and increased risk for things like metabolic syndrome, sleep apnea, and type 2 diabetes. So there becomes a very vicious cycle. And I know this person in particular mentioned that they were lean, but most women with PCOS will start to struggle with their weight. And it's because as we get more insulin resistant, our body will produce more and more insulin. And insulin hormonally drives weight gain. It drives hunger, sweet, salty, starchy cravings, poor sleep, lack of energy, lots and lots of things that are going to make us predisposed to weight gain. And then as your glucose levels start not to respond to the insulin, pancreas produces more insulin. Then you are not able to maintain your blood glucose levels, and you start to become insulin resistant, and that can lead into prediabetes or even type 2 diabetes. So to improve this, what helps a lot of women, and this is where the fasting and the diet and the lifestyle come in, is improving the insulin resistance, because the increased insulin is what's driving the extra testosterone levels and therefore worsening those symptoms of PCOS and more of that endocrine or your hormone kind of disarray. The hormones are all over the place. So there's a couple of key factors that we focus on, and these are actually the same things we do for insulin resistance, struggles with weight, or prediabetes or diabetes. And that's really making your diet, making you more sensitive to insulin or reversing insulin resistance. And the number one thing in countless studies is keeping the diet low fat. Even healthy fats, we want to cut out the oils, keep nuts and seeds and avocados to a minimum, definitely minimizing any saturated fat or animal products, preferably eliminating those. And we want the diet to be really anti-inflammatory. There's a lot of inflammation going on with PCOS, whether that be the skin, the menstrual cycle, or the reproductive hormones, lots of inflammation going on. So we want to drive that down. So what do we focus on? Fruits, vegetables, whole grains, and legumes. You want to have, like I said, as little oil to no oil, no processed junk. I mean, don't fuel the fire. We don't want any meat. And for this person that asked the question in particular, we don't want any dairy. What are you doing when you take in dairy? You're taking exogenous hormones or hormones from outside of your body. If you want to add more disarray to your normal hormones, take in extra ones. And the cow, which is where we get our dairy from, is a mammal. It's similar to humans. And those hormones that we consume from the dairy are biologically active in the human body. So we're just creating more hormonal disarray. So to the person that asked the question, dairy would be the number one thing I would start eliminating for you. And I know a lot of Indian food has a lot of oil. Would definitely be cutting all of that out as well and starting to look at what processed foods, and if you're including, I know you said vegetarian, so no meat would be the first one, no dairy, minimize that oil and anything processed. Then on the flip side, you want to really increase your fruits and vegetable intake and really focus on getting those anti-inflammatory nutrients from the fruits and vegetables into you. You mentioned stress, and stress is a perfect example. More cortisol, more insulin resistance, more insulin, more symptoms of PCOS. So really trying to de-stress however that looks best for you will be super helpful. You did mention that you were lean, but anyone overweight, really seek out some help to try and cut down that weight. Body fat can increase our levels of estrogen and again, start to contribute to the metabolic and endocrine disarray that we're struggling with PCOS. So that's probably enough to kind of delve into. There's a lot of common medications that are used, but a lot of people get a big benefit from changing their diet. Now, fasting comes in as an additional step to really address the underlying cause. And this is why I think fasting is so beneficial for PCOS, because once you start fasting, your insulin levels drop really, really low. And when your insulin levels drop, so does your testosterone. So now those two drivers of PCOS are dramatically reduced. You reduce those super, super low, come out of your fast eating a super healthy, health promoting, whole food, plant-based, oil-free, salt-free, sugar-free diet, you have a really good chance of giving your body a chance to reset your hormones and restore that normal hormonal function. I'll take a deep breath now.
Yeah,
does that answer the question?
I think it does answer a question. I think so many people are just confused because they're being put on different medications, whether it's the birth control pill or metformin or some sort of spironolactone or something like that. So yeah, what in your practice, I mean, for sure, is telehealth. How is it that you work with people with PCOS, with ladies with PCOS?
Yeah, so a lot of ladies come and they're at different stages, right? Some people have never even been diagnosed, but they have their suspicions. I mean, with the wonders of the internet, a lot of patients that come to me, they kind of already know what's wrong, which is super helpful for me, but at least they have an inkling and we know what direction we're going to go into. So a lot of people are familiar with PCOS, but they haven't been formally diagnosed. So if they haven't been formally diagnosed, we start that process of getting the labs, getting the imaging, and really making that formal diagnosis. Most people coming to me already have a diagnosis and they either don't want to take medications and are looking for a more lifestyle focused approach, or maybe they're taking medications and they'd like to come off them, or they're just trying to feel better. I mean, the medications, unfortunately, are not a cure-all. There's very few medications out there that are, unfortunately, but it is something where it tends to be a chronic illness and they're just managing the symptoms as much as possible, trying to get some benefit from the medications, but a lot of them are still struggling. And so with that, we can go two ways. Usually I start off by doing what I call adjuvant therapy, like let's work on your lifestyle as much as possible, leave the medications alone for now if you're already on them, and start getting you feeling well enough that hopefully we can start to take you off those. That's usually the goal. So in terms of working with me, we're coming up with lifestyle approaches. We're talking about what's going in your mouth. How are you stressing? How are you sleeping? What's working, what's not working, what else is in your environment? I mean, we even go as far sometimes as, your external endocrine disruptors. Sometimes there's a lot of plastic in the environment or essential, kind of synthetic, synthetic scents and perfumes and slathering things on you. And, we don't have to go 1,000,000%, but really just looking at what influences are modifiable. What can you change in your lifestyle to be able to see dramatic benefit in your health? So like I said, depending where you're starting, check, and then it's an ongoing process. Unfortunately, PCOS, it didn't happen overnight. So it may take us many months to get significant improvement. But most people that I've seen for PCOS, especially if they make dramatic changes, tend to get really impressive results within a couple of months. And my favorite thing, not everyone with PCOS is looking for this, but there's two things I love. Pain's gone away And for a lot of people, they fall pregnant. And having someone that I've seen with PCOS that falls pregnant, if that was their goal, obviously, is really, really rewarding. And that's where a lot of people are seeking help, because they're just struggling with that infertility aspect.
Yeah. Yeah. I've seen a few patients who are trying to get pregnant, and sometimes, especially with the leaner PCOS, they actually can't fast long enough to completely eliminate the cysts. And so they have to do
Yeah.
multiple fasts, and they do, maybe a week of fasting, recover, eat the food, get back, continue on with the healthy lifestyle. Even that sometimes brings their menstrual cycles back to normal. And then they might attempt another fast, maybe 3 to 6 months later, maybe 6 to 12 months later, and then continue to do it so that the body continues to improve. But it's really rewarding. So thank you, Dr. Thomas. Really appreciate it.
Absolutely. And we can't forget the other symptoms, of course. I mean, fertility is not the only thing. A lot of these women are struggling with low mood, low confidence, significant pain, horrible skin, weight gain. There's a lot of stuff going on that, any of those being improved really does improve that quality of life aspect.
Mm-hmm. And this brings us to another question that was kind of related, because it actually, the question was, I heard that there are some exceptions to the no medications guideline for water fasting. For example, if one is on thyroid medications, the dose should be cut in half during a water fast. And I heard that steroid hormones and possibly hormone precursors are another exception. So can pregnenolone be taken during a fast? And if so, should the dose be lowered? And so I think this also has to do, this person is most likely dealing with some sort of PCOS or something like that. So I'd want to know your take on it, Dr. Thomas, since, when I work with patients or when I work with people doing water fasts at home, I'm not really trying to take them off medications. We're actually starting the fast once they're off the medications. But for many people who are on medications, maybe their doctor's not completely supportive of getting them off these medications. And so then, as you know, you consult with them and are able to help either consult with them and give them some advice as to what to tell their doctor, or you actually go ahead and manage that on your own with them, depending on what state they're in at the time of your consult. So tell us a little bit more about this question, pregnenolone, whether or not you can take these types of hormones during the fast.
Absolutely. And so, kind of what you touched on before with PCOS, and one of the biggest issues, at least to the best of my knowledge, is these guidelines just don't exist. And we want to supervise fast in the safest and most evidence way possible. And so it's really hard when we can't fall on research or clinical trials that fasted people on medication. So most people that want to fast, we do exactly what you just said. We try to discontinue medications and supplements prior to fasting. And for many people, this can be achieved with lifestyle change and actually relatively fast for a lot of people, so that they can discontinue these medications safely. There is definitely medications that cannot be stopped. And the key one I always think about is insulin for type 1 diabetic. This is an absolute essential, and they would typically not be a candidate for fasting. But like life and medicine, there's a lot of gray zones, and thyroid medication is one that tends to fall into that gray zone. And that tends to be in particular when the thyroid function is minimal. So typically autoimmune thyroid disease, and they're not producing enough thyroid hormone to function. And this is very different to, say, someone with antibody negative subclinical hypothyroidism who feels better on medication, which is great. And I'm happy for you. But that's why I don't always like the blanket statement of half as well. And I know that's what other places do, and I'm not trying to discredit them. It obviously works wonderful for them. But for me, I can't wrap my head around how, if you're taking, say, 150 micrograms of Synthroid or levothyroxine, cutting to 75 micrograms is totally different to 25 cutting to 12.5. Same if you take desiccated thyroid or armor thyroid. The range of doses just ranges so much that I feel like, for me personally, I'd almost want to gradually taper someone before the fast and leave them on the lowest dose that they feel okay. But that's obviously a lot more work. So in terms of what to do with that, I think it's kind of, I would just be having that discussion with the person. But back to the original question, which was about steroid hormones, steroid precursors, and in particular that pregnenolone. And so my question, of course, is why are they taking the pregnenolone, and is it essential for their function? And so again, kind of considering the duration of the fast as well, and in general, the longer the fast, the more significant the lack of medication will be noticed. So obviously, if you have Addison's disease or something that is dependent on taking exogenous steroid hormones for normal function, that could not be stopped. And that would be another individual case we would want to adjust the doses. But for most people that are taking steroid hormones, they're taking them as a replacement or an enhancement, and they don't have that true physiological need per se. So a lot of that time, again, tapering and stopping those prior to fasting would probably be what I would recommend. Again, assuming there's no underlying necessity medically for these medications. But these hormones obviously can make a huge difference in the quality of life for many people, and I don't see a reason to make them feel miserable on top of fasting. So I'd be open to discuss it, but it would definitely be a case-by-case basis, and it wouldn't be something that I would just say on a live stream or a podcast or something, just have it, because that just is too simplified and probably unsafe. So pregnenolone, again, specifically, it's an endogenous steroid, and obviously they're taking it exogenously or outside the body, precursor or metabolic intermediate in the biosynthesis of most steroid hormones. So progesterone, androgen, estrogen, glucocorticoids, and mineralocorticoids. So it is biologically active in its own right as well. It's a neurosteroid. The levels naturally decline as people age, so people become interested in supplementing or taking that as a prescription. But again, kind of same as the steroid hormone, if there's not a medical underlying need for it, most of the time I'd recommend a taper and discontinuation prior to fasting, maybe discussing it on a case-to-case basis. What are your thoughts? Have you done much fasting on any other medications?
Yeah, really the thyroid medication, when most people are telling me that they're on medication, we typically either talk with their doctor, they send them to you, and they're able to cut the thyroid in half. It's rare we have people on very high levels of thyroid dosage. And if they are, then a recent blood test will actually tell us whether or not they're over medicated, which is usually the case.
Yeah.
So if they get to a lower thyroid dosage when they're fasting, the thyroid just works better when you're not, when the metabolism is slower and you're not eating any food, then they can get off, they can lower the dosage. And then when they're done fasting, they just go back on the normal dose. Or if maybe they improve their thyroid function, and sometimes people will tell me, well, they don't want to go on that much thyroid medication after a fast. So they schedule a blood test with their doctor and just confirm maybe about 8 to 12 weeks later to see, after they've reintroduced food and they are back to normal life and their normal metabolism, then we can actually see if their thyroid function improved. With other hormones, yeah, sometimes it's always best, just because when you start to introduce all these variables to the fast, then we just have, we don't know if what's happening to you when you're fasting is good or bad. So we try to eliminate as many variables as possible so that we know for sure. So, if someone has good baseline data, they're checking their vital signs and they're feeling quite miserable, which can happen during a water fast, but they're also now taking some hormones like estrogen or testosterone or pregnenolone or something like that. Then they start feeling hot flashes, or they start to feel, mood swings. Then we can kind of chalk it up to maybe they are getting over medicated at the time of the fast. And so it just becomes another thing to manage that we would rather just focus on. Fasting is miserable as it is. And then we have to add in some hormones to it as well. So, however, because those hormones, many times people have been on them, if they've been postmenopausal, they've been on them for, 5, 10, 15 years, they're sometimes unwilling to or unable to get off of them quickly enough to fix a fast. In other cases, they're not actually trying to fast to improve their hormones. They're trying to fast because they're getting into junk food and they just need a reset and they need to get back on track with their health so that they can improve their health long-term. And so at that point, and their doctor may be, months away from being seen, and they're not really that interested in trying to convince them to lower their dosage, and then having to get a lower, different prescription type. And maybe they're in a state where Dr. Thomas, where you can't work with them yet. And so for those reasons, we do short fasting. And if it's indicated to decrease the meds, then they will, with the help of their doctor. But if it's not, then we can do a short fast, 7 days, maybe occasionally 2 weeks. And most people who do fasting longer than a week, they'll actually reduce their meds down to 0, taper them off in a good schedule. And so they can find that their doctor will help them find a good taper schedule, work with them. And so there's ways to do that. But yeah, for the most part, we try not to do a lot of fasting with medications. But there is a big difference between a medication like high blood pressure medication and hormones. So the way almost all medications work, other than say antibiotics, is they all work to pharmaceutically alter your body to affect a particular symptom. Okay, so antibiotics work by preventing a bacteria from getting out of control, essentially. So they're not altering your body to some extent, but what other medications are doing is they're pharmaceutically altering your body to prevent you from experiencing a particular symptom. So they block a certain pathway, or they, in case of high blood pressure, there's many different types of high blood pressure medications, but let's take one, for example, that, for example, may slow down the heart rate in order for the blood, and it weakens the heart so it doesn't pump as hard. Or it may try to relax the arteries in your blood vessels so that the blood pressure isn't quite so high. So in all those cases, these type of medications, they're altering your body's normal natural function. Okay. And so as a result of that, when they alter your body's normal natural function, you have side effects, because there's many dozens and millions and lots of things that are happening all at the same time. We haven't quite figured everything out with the body. And so anytime you try to pharmaceutically alter things, you're going to have side effects. And one of those side effects is the byproducts that are created when the medication gets processed in your liver and your kidneys. And so that's why it's called pharmatoxicology, is because there is a bit of toxicity that goes on with these types of medications. So this is one main reason why you don't want to fast on these types of medications, is because you have an effect called potentiation, meaning the medication gets more effective. Well, if it gets more effective, it also gets more toxic. And so we generally don't want to be going into a fast while we're on these types of medications. Now we swing back to things like thyroid hormone or other hormones, which are natural parts of the body's function. And so that's why there wouldn't be as big of a negative effect if you're adding hormones to the body when you're fasting. But there is still a problem, because your body's changing its metabolism slightly when it's fasting. And so we don't come into the liver damage and kidney damage we'd expect to see if someone's on serious doses of medications like prednisone or some sort of blood pressure medication. And so that's why we're much more cautious, and we want people to phase off, with their doctor's help, off those medications. And then with the hormone, things like that, it's just not going to be as big of a problem. So a little bit of long winding out answer, but that's the big difference between those. Antibiotics is a separate issue, because in general, your immune system does improve while you're doing a water only fast. However, if you have a raging infection that you're taking antibiotics for, we don't want to interfere with that. Particularly, I just tend to think if you're on antibiotics, because, well, in some cases, some doctors will give them out like they're candy, but I'm assuming that the doctor's doing a good job and actually only giving them out when necessary. And if that's happening, in particular, the most times I've dealt with antibiotics, people trying to fast with antibiotics, is when they discover, we do a urine test before we do any fast, along with some normal blood tests. And every so often we'll discover that the person actually has an active symptomatic UTI, a urinary tract infection.
Mm-hmm.
And so in that case, what we don't want to happen is for the bacteria to go untreated, crawl up the urethra into the bladder. Now we have a bladder and potentially kidney infection, which is much more serious. A fast is not going to take care of that as easily as an antibiotic. So in that case, we finish the course of antibiotics. Maybe that's a good chance to continue on a healthy diet, drink lots of fluids, get some extra salt and caffeine out of your system. And then we start the water fast after the week and a half when you're done with that. But most of the time, people aren't taking an antibiotic for like a little flu or some sort of, infection or if they have a traumatic injury that they need an antibiotic. God forbid we do a fast, because that brings into actually another question, which is, should we do a water fast? Actually, one of our questions that someone sent in by email, let me pull it up here, is, I just broke my left wrist and I've been wanting to do a water fast. I've been sitting at home, kind of getting into junk food. So is this an appropriate time to do a water fast? And I'll go real quick over this. And then Dr. Thomas, I want you to wind out based on what I just said about drugs and then also fractures. So in general, you don't want to do a water fast while you're having a fracture. You want that bone to heal. And once it's healed and you can put weight on it and you can move around, then we can attempt a water fast. But we generally don't want to interrupt that process.
Yeah, I think taking away your essential nutrients for healing and things is probably not going to be the smartest idea. But I think it's a perfect time to introduce the health promoting diet while you're sitting at home, instead of getting into the junk food. That's not going to optimize your healing. So if you want to heal as fast as possible and to potentially be ready to do a fast sooner than later, I would recommend working on getting as many fruits and vegetables in as possible and cutting out kind of that any processed junk or anything that's going to create more inflammation in the body. Obviously, healing the wrist is an inflammatory process to some extent as your body starts to heal everything, but you adding in extra isn't going to do you any favors.
Wonderful. All right. Okay, so we have let's shift a little bit. And did you have anything more to add about the medications? I know I kind of went on a long time about different medications and the types.
No, I think we covered most of it. I think a lot of it really just comes down to the individual. Like you say, what are their goals? What are they taking? Why are they taking it? And what options do we have? But the only thing I thought about when you were talking about it is really, if we're thinking about PCOS or something, when you're wanting to reset your hormones, taking one while fasting kind of defeats the purpose. So I think it kind of really depends on the person. I'm not sure I have anything additionally to add to that. I probably think of something in like 5 minutes, but I would just say if you're interested in fasting and you're on medications, have a chat to one or both of us. We can really let you know what we think would be optimal, what the plan would be, and go from there.
Wonderful. All right. Okay, very good. So let's actually pivot a little bit and ask a couple of questions about salt sensitivity. So I'm severely salt sensitive. In other words, 1 or even 2 grains of salt can increase my blood pressure by 40 to 50 points. I recently heard that miso seems to have no effect on blood pressure, but may lower herd rates. After some research, I found several medical studies that seem to confirm this. However, given my condition, would you recommend giving miso a shot?
That's an interesting question. There's a lot of people that I've seen that come to fasting that are super salt sensitive. And I don't know if that's what draws them to fasting because nothing else is working, or whether it's just that a lot of people are salt sensitive and we're having educated individuals come to us that have figured out that it's because of their salt. I would be interested to see those studies. And the reason I say that is because I'm wondering whether it is adding miso to a salt-free or low sodium diet, or if it is replacing salt with miso. Miso obviously contains soybeans, often rice, and other ingredients that by nature of that, you're going to reduce your sodium compared on an equal amount to taking straight salt. So my thought process being maybe in those studies, they reduced their sodium and that's why they got beneficial effects on the blood pressure. But miso itself is extremely high in sodium. I would find it very challenging to believe that that would help lower blood pressure. So I'd love to see those studies. I'm always open to be wrong, but I haven't seen it. I wouldn't think that would be the way that I would go. I just haven't seen any evidence for that. And the entire logic of it doesn't make sense to me and why that would be helpful, other than if they were compared head to head with salt or with something a lot saltier and the people just reduce their sodium overall. I've seen that as well with some kind of like lower salt seasonings. I know there's a couple that they're split 50-50 with herbs, or split 50-50 with some kind of sea vegetable that tastes salty. And then you look in their studies and they have lowering of blood pressure, but it's because they were on a much higher sodium diet and they've naturally slashed it in half. That in and of itself is going to lower the blood pressure. But if you add that to someone that's consuming virtually no added salt or sodium, they're just having what's naturally contained in the whole foods. Adding that in, I cannot imagine that their blood pressure wouldn't go up if they were very salt or sodium sensitive. So I would be very cautious with that. I mean, like I said, I'm open to be wrong. And I also think if something is relatively harmless and easily reversible, you could give it a shot, as in try it one day and see what your blood pressure does. But I think if you see any changes in your blood pressure, I wouldn't be continuing to kind of push through and see if it works. It doesn't sound like it would. And I just can't see how it would be helpful. But yeah, send the studies over. I'd love to see them.
In many of these studies, I used to read a lot of these when I was in school, and I love to discuss and argue with the people who basically wanted to eat a lot of salty, oily animal foods and whatnot. In many of these studies, there's a lot of false correlations, and correlations does not equal causation is really the truth. And so, those studies, I'd be shocked if they had any kind of evidence to them, if they were just nothing but just a few correlational studies. I wonder, Dr. Thomas, if you might be able to, pull out a crystal ball and say, could there be anything else going on if someone's blood pressure goes up by 40, 50 points? That just seems unusual for that to happen in an otherwise healthy individual. Anything you can kind of speculate with?
Yeah, that would be something that I would definitely want to do a good kind of medical history and exam from to figure out, because that is a very dramatic response to sodium. So I would love to know, what is the kidney function doing? What is their overall diet? What is their orthostatics and their kind of, autonomic nervous system doing? Like, that's a very dramatic response that I think it warrants more investigation, probably along the lines of labs and kidney imaging and things like that, to really figure out what's going on underneath, as well as even something like the adrenal function. That would be something I'd really want to look into. That does sound an extreme response to sodium in and of itself.
Right. Okay. All right. Our next question. I seem to have a sensitivity to citrus, which I enjoyed and would think would likely be good for a balanced diet, but I get long-lasting painful mouth sores after eating most citrus, especially lemons, and get them with limes and oranges, even eating some non-citrus fruits like cherries or tomatoes. Apparently, there has been at least one study indicating that taking B5 and coenzyme A supplements can help with this type of sensitivity. What is your take on this? I try to avoid supplements as much as possible, but because I believe that a well-balanced whole plant foods diet is vastly preferable to taking supplements. I'll let you take this entire question, Dr. Thomas.
That's a great question.
And the reason is, my general attitude is if a food gives you sensitivity, you don't have to eat it. And so that's kind of my general attitude about it. And then, you eat it until it starts feeling bad and then you stop eating it. So, yeah.
Citrus sensitivity is remarkably common. In fact, one of the most common causes that I see of reflux and esophageal irritation is people that drink lemon juice. And I know it's promoted and loved across many health places, but I do not recommend it because I've seen a lot of people with chronic inflammation and problems from drinking lemon juice. And I think that I'm on the exact same page. If something is bothering you, it's your body saying, don't do that. And usually the more you have, the worse your symptoms are going to get over time. So I honestly think that probably eliminating the citrus, and the reason those other foods were mentioned, I think they said they had cherries or tomatoes. These are all very acidic things. And the concentration of them as well, and the changes in the way our food has gone, a lot of our fruits and vegetables are becoming more and more acidic than they used to be. The sugar content's gone way down, or the Brix value. And a lot of these foods are just not really that tolerable for a lot of humans. So I'm on the same page. I recommend if they're causing you problems, I would cut them out. I don't recommend supplementing or using kind of a band-aid approach to being able to consume them. There's no reason to have citrus in a well-balanced diet. You can get all your nutrients that you need from other fruits and vegetables. There's nothing specific to citrus that we absolutely need. You can get your vitamin C and all those things from other fruits and vegetables. So I'm sorry to be the bearer of bad news. If you love it, I'd probably recommend seeking new favorite foods, at least for a period of time. I'm going to add in a little anecdotal story. Of course, this is not a scientific study, but I was severely allergic to citrus for the majority of my life. So you can grow into a healthy adult without citrus, but sometimes they go away, and the sensitivity can go away in certain people as well. I've done a lot of people where we cut out citrus for about, it depends on the person, but maybe 3 months or so. And what that does is it allows all the epithelial linings to heal. So if you think about having a blister, right, on your skin, when the skin peels back, if every day you kept squeezing lemon juice into it and rubbing it in, it's never going to heal. It's just going to hurt every single time you do it. If you stop touching the blister, cover it with a hydrocolloid patch or some barrier cream and just leave it alone and let it heal, now you can pour lemon juice on your skin and it doesn't hurt anymore. So sometimes with the citrus sensitivity, it's usually just a period of letting it heal and working on other aspects of anti-inflammation in your diet and lifestyle, then seeing if you can introduce small amounts and in less concentrated ways. So instead of maybe lemon juice, maybe having a little slice of orange in your salad and seeing how you go and seeing whether you can retolerate it in the future. So often food sensitivities are temporary, and there's a matter of addressing what's going on underneath that's causing the irritation, the inflammation underneath, or the irritation, why it's bothering you, kind of fixing that and then trying to reintroduce. If it continues to cause symptoms, I'm sorry to say it's probably something you're just going to have to give up.
Wonderful. And for this particular person, I know that they are doing an at-home fast right now. And so we're going to try actually and reintroduce these foods after they're done and see kind of slowly and see if they re-irritate things. So, all right, very good. Our next,
go ahead. I was going to say, how much do you see, again, I'm just thinking theoretically with fasting, how much do you see allergies improve? And I'm just wondering, because obviously there's a lot of improvements in your blood and your antibodies and your immune function. I'm wondering how many people that have, say, a food allergy, do we see them get well in the future? Probably wouldn't be testing like an anaphylactic allergy, but just say like a mango irritation or something, or
strawberries or something. The what is it? The class 3 hypersensitivities we don't touch. Mm-hmm. We don't go. No. We don't want to try have the EpiPen standby. That's not what we want to try. But what I actually notice is many people who say that they have, quote, allergies to the pollen or whatever, really what they're feeling are effects of detoxification after they've stopped eating junk food. So their nose starts dripping. They have a plugged up nose. They have to blow their nose a lot. And so whether that's allergies or not, it's kind of hard to say. It's just the body's reaction to the normal toxic load that comes from our diet, our air we breathe, and the food and the food we drink or the food we eat, the the beverages we drink, and the air we breathe. And so when we eliminate those from our bodies and give our body a break, then oftentimes people say they can breathe better. They can go outside in the pollen or in a humid or dry condition, and they feel much better. They can breathe better. They can walk and they can exercise without gasping for air. And they will actually try to experiment certain foods that they maybe didn't like that much before, because they would give them these reactions. Now, very often, the kind of foods that are giving them these reactions are the foods that we don't recommend. So it's like, well, I'm allergic to cheese. It's like, good, perfect. That's good. We don't want you to be like feeling great when you eat cheese. And most people don't feel great when they eat cheese. They feel that dopamine rush, but they don't actually feel healthy, and they don't feel good. And so many of these foods, your body is essentially speaking to you, telling you, giving you a signal not to eat them. Now, in terms of like fruits and vegetables, like mangoes is a common one, strawberries, bananas, that people feel like this excess mucus production occurs when they eat a lot of these foods. But when people finish fasting, we slowly kind of dabble and reintroduce that. And oftentimes people tell me they feel a lot better, or they're kind of cautiously optimistic, because we don't actually know in the very beginning of the refeed stages, which the refeed lasts about half the length of the fast. If you do a 10-day fast, we're slowly reintroducing food for 5 days after that. Now, what will really get a lot of good information is 2 weeks after that, and then 6 weeks after that, and then 3 months after that. And so this is where people will sometimes write to me and say, I'm feeling way better. A few things here I'm playing with, and I'm doing much better. This one, some of the more sensitive things they completely eliminate. They're going to try again in 3 months or in 6 months. And so yeah, very often we see the more mild reactions improve quite a bit if we do a long enough fast. And sometimes it takes a couple more fasts after that.
Awesome. I love it.
All right. Our next question. Would you please discuss something that even the most well-known fasting guru doctors overlook? Oh, okay. Big question here. All right. We're going to try to do what they don't do, apparently.
Oh boy.
And this is how to build back the body and put muscle on after a longer fast for someone who's already lean and has not that much fat to lose. So just to give credit to my mentors, and that's most likely, for me, the fasting gurus are Dr. Goldhammer, Dr. Sultana, Dr. Linsner, the doctors at True North, Strucker, like all the doctors at True North, those were my mentors, Dr. Clapper. And so, we did talk about putting muscle back on, but let's actually back up the camera and say, what is putting muscle back on? It kind of, it's not really the accurate way to describe, quote, gaining muscle. It's not like you eat, protein tissue and then now you just get it to like stick to your bones. Okay. Yeah. So that's not quite how it works. And even the question about, protein, the idea that you have to eat muscle tissue in order to gain muscle tissue is actually a misnomer as well. Okay. So what's actually happening with our skeletal muscle cells is that when they are being used, they actually grow bigger. Okay. And when they are not being used, the body essentially doesn't need to have as much nutrients in there. And those fibrils are not actually, they're actually shrinking in size. Okay. So when you're doing a water fast and we're recommending that you stay actually at rest, you're not using up your muscles, so that the tissues don't tear and have difficulty regrowing again, those muscles are actually getting a little bit smaller. They're not being used. So when you're done fasting and now you have calories, you have electrolytes, you have things that your body can safely exercise and reheal any type of injury, then those muscles will start to grow bigger again. Okay. So that's how you, quote, put muscle back on, is you simply have to engage in exercise when you're done fasting. Now, it's not like you're going to go from, the day before you started fasting and then 15 days of a water fast, and then you get back to what you were 15 days ago. No, because those muscles got much smaller in those 15 days. Because it's not like you stopped going to the gym but you're still walking around carrying groceries, things like that. No, you actually had a total complete rest. So your skeletal muscles will go smaller, and it will take some time, sometimes several weeks, for those muscles to actually grow back to their normal size. And so that's kind of, that's how we look at it. So when we're actually going through the refeed period, I'm encouraging people to start doing some walking around, some squats, get those big muscle groups going, some push-ups on the floor, some exercise classes, a little bit of weights if they have time, or if they have a gym nearby, in a couple of weeks. And now they start to get just as much exercise, even better, because they have energy afterwards. What say you, Dr. Thomas?
Yeah, I think probably a couple of important things to point out is obviously we always talk about this a lot, but fasting is not starving. So when you're fasting, you're using up your glycogen and you're using up your free fatty acids and fatty tissue, and the glucose your body can produce without food. So you really shouldn't be breaking down or losing muscle tissue. Most of the time, if we're starting to break down protein or a lean tissue, we've gone too far, which obviously we don't do. So the terms of the loss of it, I wonder how much they actually think they've lost muscle compared to just how the muscle fullness is. So obviously the first thing we do when we're not eating is we lose all the glycogen. There's a lot of glycogen stores in our muscle. And what does glycogen have with it? Well, 3 times its weight in water. And so you're going to lose a lot of that water as well, not just because it's stored with the glycogen. We lose even more water through the natural diuresis that happens because we're not having as much sodium or salt in food. So we lose a bunch of water from diuresis, a bunch of water attached to the glycogen. All that fullness in the muscle is gone as well. And you probably feel like you've lost half your body weight in muscle, right? Whereas really the lean tissue itself is generally not touched during fasting. So technically you still have all the same muscle. It's just a matter of refilling it, refueling it, rewatering it, and re-strengthening it after that period of rest. And so that's kind of the first part, is you probably don't need to regain it. You just need to bring it back to where it was. But if you truly are wanting to gain lean muscle mass, it's exactly what you said. A muscle grows when it's stressed. I'm a big fan of strength training and weightlifting and muscle building, because we know that having increased muscle mass and decreased body fat is essential for health and longevity long term, especially in those big muscles like our legs and our glutes, really correlated with good health and long-term function. You know, one of the number one reasons people are admitted to nursing homes is that they can't get out of a chair. So having really good physical fitness and muscle mass is absolutely essential for longevity. So exactly what you said, once you start refeeding and getting your strength back, getting straight back into resistance training, walking, strength training, squatting, will really help you start to rebuild that muscle, and slowly increasing your resistance over time. So whether that be heavier weights, more reps, and you probably need a little more food as well, you know, starting to eat more to see that you're gaining that muscle as well. And that all happens over a period of time. Exactly what you said, you can't snap and be a bodybuilder tomorrow, but it does happen over the course of months to years.
Mm-hmm. And one other benefit, maybe last year I was at a little get together, and I was surprised to see one of the brain doctors, Dr. Dean Sharzai. And we were talking, I thought, I'd seen his videos. If people are interested, they're called The Brain Docs, him and his wife. They have wonderful channel, podcast. They discuss, they're neurologists. And so they discuss all types of different ways that diet can improve mental function. And we were talking, and he said, you know what the number one factor for decreasing dementia is? And I asked him, I said, what is that? Because quadriceps strength.
Mm-hmm.
So
isn't that crazy, of all things?
Mm-hmm. So I started actually from that. I read a little bit more into it, and I started actually recommending that everybody who's done fasting, they start to get some squats in. Okay. Even if it's squats on a couch, so that if you fall back, you can get back up. But we want to get those big muscle groups starting to exercise, because that's going to, people will sometimes esoterically say that, your quads, your big muscle groups are like its own circulatory system because it's pumping the blood so much, whether that's kind of accurate or not, I couldn't say, but we want to get those big muscle groups going, pumping blood, helping your body and getting us stronger, because like you said, Dr. Thomas, the last thing we want is to grow older and not be able to even get up from a chair.
Absolutely. Absolutely. And there's so many benefits to increasing muscle mass, in particular, those large muscles. I mean, the more muscle you have, the more, when you're exercising, more vasodilation helps with your blood pressure management. The muscle tissue is greedy. It loves to take in all the carbohydrates that you eat and burn through those sugars. And it really helps with your insulin sensitivity or insulin resistance decreasing, making your metabolism a little faster, metabolic system working better. There's so many benefits. We could go on. We could do an entire video on the benefits of exercise, but really can't underrate that muscle building for sure.
Wonderful. And just going back to the exercise, one of our viewers is asking, how soon can we go back to brisk exercise after water fast? The answer is it really depends on how long you do a water fast for. Most people are able to go back to some sort of physical activity on the first day that they're on a solid food is what I recommend. But that doesn't mean a full, full basketball game or hockey game or whatever it is. Usually people will ease into it, and usually about half the length of their fast, they're feeling like they're back to normal. And if it's a very long fast, maybe 2 or 3 weeks longer, it can sometimes take a few weeks to get back to your full full amount of exercise and intensity. Yeah, and you want to. The question is also, once I'm done refeeding, should we have to wait a week or two and then ramp it up? And I would say that the first day that you're on solid food, we actually start to have you go and do some activity and ramp it up. So usually I'd recommend about 25%, then about 50%, maybe a day or two later, then 75%, and then kind of go from there and see what makes sense. The older you are, you also going to be checking your blood pressure, make sure you're not getting into fainting and passing out, things like that. But that's about the routine that we do.
Perfect.
All right, Dr. Thomas.
I love it. I think that's one of the, yeah, go ahead.
Yeah, go ahead. I'm sorry.
No, I think it's one of the things that you see is people are like super keen to get back to their fitness, and then they go all in on day one, and then they're injured and they have to take 2 weeks off. So
right.
I always say, start low, go slow. If it takes you 2 weeks, but no injuries, awesome. If you're going to go all in on day one and get injured and need 2 weeks off anyway, what was the point? So take it easy, take it light, listen to your body, don't go crazy. Totally agree with that.
Really. And it reminded me actually, the reason why, for people wondering, why do we go so light in the very beginning? It's because your big muscles have actually reduced in size because they haven't been used. But also what's reduced in size is your tiny muscles called the stabilizer muscles, okay? Also called your core. If you've heard people say you got to get your core up, those are the muscles that are in the 6 layers of muscles in your back, and they prevent your disc from your vertebrae from moving too far one way or the other and straining your disc. And actually they're your postural muscles. So if those are also weaker, then you're going to be more prone to injury if you try to go full gung ho 2 days after a long water fast. So you want to ease that up. Do some walking, some squats. Those will also build up your stabilizer muscles as well, back to where they were. Okay. Now, if you've been very active and you've had a lot of exercise in your life leading up to a fast, it'll come back faster because just exercising a lot, your body grows new blood vessels to those tissues. And so you will get better. You'll get back to your normal routine much quicker than someone, say, who's just beginning a new exercise routine. So even before you fast, it's a good idea to start doing some walking, some exercise, even some squats. And if you can't do full squats, do it against a chair until you can do it without a chair. That's always going to be helpful, no matter whether you're fasting or post-fasting or considering a fast. All right. We're going to do, we've got one question here. Or a couple of questions here, and then we'll wrap it up in just we got maybe about 4 or 5 questions left. So if Dr. Thomas, if you don't mind,
rapid fire.
Yeah, we'll do our best. Okay, so dear doctors, what are your thoughts about adopting a plant-based keto diet after fasting? This person explains a significantly higher protein to carbohydrate ratio has been recommended to me as a possible way to help body metabolically orient itself towards higher fat consumption while one continues to exercise and eat healthy. In other words, is there a healthy way to encourage or induce a mild or moderate amount of non-fasting ketogenesis on a plant-based diet without having to add copious amounts of oil to food? Well, let me take this one real quick, and then Dr. Thomas, you can actually wind out on it because you have the medical verbiage that I think is what's necessary here. There's one actually major assumption being made here, and that is a ketogenesis or ketosis is a favorable place to be in metabolically, outside of fasting. So ketosis is this. It's studied and it comes with fasting. It also comes with diabetes, but the healthier, I guess, the less harmful ketosis is done, is the state your body enters into when you're fasting. It enters into when it's diabetic as well. And what it is, it's your body's way of burning ketone bodies in favor of sugar when there isn't any sugar and there isn't any food coming in. And so it is, your body breaks down these chemicals called ketones, and it's stressful. It's stressful to the liver, it's stressful to the kidneys. And so it's not a desirable place to be in long-term. Your body's not designed to be in ketosis long-term. And even with people doing long fasts, ultimately, if someone does a long enough fast, even if they have enough nutrients, even if they have enough fat reserves, kidneys will end up being very stressed out because of this ketosis process. So it's not a desirable effect. It's not a desirable place to be in to try to get your body into ketogenesis or ketosis. That's my general stance on any type of keto diet, whether it's plant-based or not. You're misunderstanding. This person is misunderstanding the body's actual design. It is designed to burn carbohydrates. Okay. It is a carbohydrate burning machine. And if you want to know more about this, I would read a book by Dr. John McDougall. It's his kind of a virtual mentor of mine, and probably Dr. Thomas's as well. And he wrote a book called The Starch Solution. Okay. And he explains this, all over the place, that we are actually designed by nature to be burning carbohydrates and consuming carbohydrates in large quantities. This is how our system is built. And you can verify this looking at all kinds of different measurements for the human body. If we look at, say, a cat or a lion or other types of, animals, they aren't actually carbohydrate burning machines. They eat other foods as a predominant part of their diet. But humans, we are omnivores. So we are capable of having things like lots of protein, lots of fat, but we're actually optimally designed to eat carbohydrates.
Absolutely. To tag on, I love Dr. McDougall too. There's a great video for people that would rather watch a video by Dr. Mills, and it's Are We Meant to Eat Meat? And it goes through all of our body, like our tooth structure, our digestion, metabolism, everything, and kind of explains why we do predominantly thrive on a carbohydrate-based diet. So just another one to kind of throw in there, but totally agree with all the wonderful work of Dr. John McDougall. And I totally agree with what you're saying, is that there is a misconception or a belief that perhaps being in ketosis or close to it is of somewhat benefit. And we just don't see that consistently in a lot of the research beyond the state for fasting, but there's many other things happening with fasting. So I think that real question is, why was it recommended? And the number one reason I see it recommended by very well-meaning doctors is that there is some level of glucose metabolism problem, right? Maybe your fasted glucose is elevated, your A1C is elevated, your insulin is elevated, and it's automatically assumed that your insulin resistance means you can't process carbohydrates, which is true at the time. But similarly to what we were talking about with the PCOS, is that we can reverse insulin resistance pretty rapidly and pretty readily by reducing the fat, and in particular saturated fat. So when we're talking a plant-based diet, we can get caught up with oils, we can get caught up with coconut and coconut oil products, and a lot of the processed foods or mock meats or things that can be included in a plant-based diet that can cause that saturated fat toxicity that interferes with your glucose and insulin receptors and starts to cause insulin resistance. So when you eat carbohydrates, yes, your blood sugar goes high because you're resistant to the insulin your body's producing. You drop that fat down, you bring your diet to a whole food plant-based diet, and all of a sudden you can eat an abundance of carbohydrates with great blood sugar levels. So I think that's where it comes in, because if you have a low carb or keto diet, you're masking the problem, because if you don't eat any carbohydrates, your blood sugar doesn't go up. And so people think it's working well. And I kind of become cautious of this a lot recently, because people are using a lot of CGM or continuous glucose monitors, and they see their blood sugar go really high. And when they have lower carb foods, their blood sugar doesn't go up as much. And so they think that they're better for them. But the gold standard test that we've always had for insulin resistance is, how do you tolerate carbohydrates, say a glucose tolerance test or just eating carbohydrates. And if your blood sugar goes really, really high when you eat carbohydrates, you don't have a carbohydrate problem, you have an insulin resistance problem. And so we need to address that underlying insulin resistance so you can go back to your natural starch-based low-fat diet that you're designed to thrive on. And most people feel a lot better. You have a lot more energy. Your digestion will be better. You just thrive because that's the optimal diet for you, is predominantly carbohydrate-based, rather than kind of forcing yourself into a plant-based, keto, high-fat thing that, for, again, well-intentioned, probably isn't going to fix the underlying issues, and you're probably not going to feel all that great, because, as you said, you're in an adaptive or a survival state, not a thriving state. Your thriving state is fruits and vegetables, whole grains, legumes, a little bit of healthy omega-3s that are contained in those foods typically. That's the optimal human diet. There's really no mistaking that. All of our longest lived populations around the world, long living in good health is what I always want to say. We can prolong life pretty much forever with medicine. You can be comatose, no brain activity, and we can keep you alive in a hospital, which is really sad, but that's what it is. We don't want that. We want you to thrive and live well into your 90s, live to 100, playing sport with your family, happy, laughing, living well in the absence of illness. That's what we want. And that's what happens with the majority of the world that follow a plant-based, high carbohydrate diet.
That's a great point. And if I wanted to say something about those continual glucose monitors. Exactly. It's how quickly the blood sugar gets cleared is really, really the question. And so if we were going to take a blood pressure monitor somehow and we were to strap it on a professional athlete in the middle of a match, we'd see their blood pressure at probably 160 over 110. Okay. But that doesn't mean we should avoid all exercise, because God forbid our blood pressure goes up during exercise. And so we shouldn't avoid foods just because they spike the blood sugar. They're supposed to spike the blood sugar. That's the whole point. That's how your body triggers insulin. That's how the drop triggers glucagon. This is all a part of how your body works. And so we don't want to avoid things that your body does naturally. We want to eat natural food so your body can clear out the blood sugar.
Absolutely. Absolutely.
All right. And so here's another question. I've been diagnosed with an umbilical hernia in which a bit of extraperitoneal fat appears to have penetrated through the linea alba. Interested in ways I can reduce the amount of extraperitoneal fat with diet, exercise, and fasting in the hopes of reducing pressure on the defect in the sheath while I decide whether or not to get surgery. So I think this is the person who's trying to figure out whether they should do a plant-based keto diet to lose weight. So.
Again, like I mentioned with the PCOS, the more insulin resistant we are, the more insulin our body produces, and insulin as a hormone drives body fat gain, especially around the midsection. So exactly what you're trying to avoid. So absolutely optimizing your insulin sensitivity by consuming a low-fat, carbohydrate, whole food, plant-based diet is really how you're going to have your best bet at reducing that body fat, especially from the midsection, and helping to reduce your fat enough to hopefully influence your hernia and reducing those. Fasting's great. I've seen a lot of hernias, small ones obviously, improve and almost completely resolve with fasting. That's been something I've seen multiple times, which is really cool. And reducing your intra-abdominal pressure is also important. So making sure that you're not constipated or bearing down will help reduce hernias. If you're doing kind of exercise, making sure you're not valsalvating or bearing down. And there's also certain techniques like vacuums or stomach exercises where you can actually teach yourself to reduce that diaphragm pressure or intra-abdominal pressure that helps to kind of draw that back in rather than pushing it out through your herniated area.
Wonderful. All right. So our last few questions. Is it okay to do water enemas during water fasting? So I get this every so often, a little less so now that I've kind of come out in different talks and said that we don't recommend enemas during fasting. So let's actually go over what an enema does. Okay. So an enema is a bag full of water, and it's got a tube in there. And what people will do is they'll stick the tube up their anus and or in their rectum, and they will let the little valve bring water into their colon, and they're hoping that it kind of switches around, and then they can have a bowel movement. Okay, so I'm sorry for kind of the extra description, but this is how an enema works. Now, it all seems okay if we kind of think about it like it's just a tube filled with water and you just wash it out. But we have to remember what else is in the gut. Okay, it's not just a PVC pipe or a squishy PVC pipe of tissue. It's got bacteria. It's got electrolytes. In many sections of the large intestine is where some vitamins are made, and so like vitamin K, vitamin B12. And so just by putting water up there, you're disrupting things. Okay. Even if you put the most pristine, best distilled pure water up there, you're still disrupting an environment that was not meant to have water, pushed up there. Okay. And so I don't recommend doing enemas for that reason. Okay. The other thing is that when we start to do enemas, first off, you're not getting the entire bowels. Usually it's just the lower part of the bowels that are getting affected by an enema. So even if you have some theoretical waste that isn't coming out, an enema isn't going to do all that much for if there is waste in the upper, the transcending, and the ascending colon as well. And also in the small intestine either. So for that reason, I don't recommend water fasting and enemas. I don't recommend enemas in general, unless there's a significant reason to do so. And sometimes there are, but for most healthy people, they don't need to do an enema. There's other reasons why not to do an enema. And one is it can be habit forming. And other is it can prevent us from actually doing what normal things we can do to have normal bowel functions, like exercising, getting good sleep, and eating high fiber, rich plant-based foods without too much. If you eat a lot of fatty foods like avocados and coconuts and oils, things like that, you're going to have some slowdown of your motility. So for those reasons, we don't recommend enemas. Dr. Thomas, what do you say about that?
Yeah, I'm with you. I think the enema is more problematic for most people. I mean, just even bearing some of the crazy perforated bowels and things that can happen with enemas. I think that we just have to be very careful in doing things that are almost masking symptoms or trying to fix problems without really addressing the underlying cause. a lot of people that, especially if they're coming from a plant-based diet, are very almost proud of their regular bowel movements, and they need to let go of that fixation while they're going through a fast. It's not going to happen during a fast. It's just, you're not taking in anywhere near the amount of food volume you were taking before. And it's actually perfectly fine to go some time without having a bowel movement while fasting. So I think letting go of that thought process that they're normal and I have to have them to get the toxins out or whatever people are thinking while they're fasting, letting go of that and kind of listening to people that are very experienced in fasting, that it's okay. And I think that, yeah, like I said, if you're out of the fasting with using enemas and things like that, addressing the underlying problem. And the thing that I've said a million times with fasting is you can't do one thing in a complicated system like the human body. And once we start flushing things up and out and around, and we're going to start having electrolyte disturbances and all kinds of things that we don't want at any time, let alone when the body's in a more vulnerable state of complete water fasting. So I think it is a recipe for disaster and should be approached with caution, and probably not at all.
Yeah, I think the one time I had a patient who brought his own enema, insisted on doing enemas, and I recommended against it. So we got blood work right after, and sure enough, his electrolytes started dropping, and we, he had disrupted something in the body, so we had to break the fast. Okay, exactly. Our last couple of questions. What's that? Yeah.
I said it is exactly my thought process. And just because there's always somewhere out there, even the enemas, like fleet enemas that contain electrolytes and things like that. Again, you're trying to add in synthetic things. You add one electrolyte, you're chasing another, and the body's a very complicated system. I often say, I had many years working in a hospital. It's hard enough to manage electrolytes when I have 6 hourly labs and IV infusions at the ready. Whatever I want to do, I can do, injecting straight into the vein. It's still hard to get electrolytes right. So starting to mess around with that during a fast at home, you're just going in territory that I think is just not studied and not safe.
Yeah. Excellent. All right. Our last couple of questions. Do we have to stop all supplements for water fasting? Yes, in general, we don't want any extra variables in there. And so I recommend stopping all the supplements for water fasting. If someone is, for example, has some indications that they're severely deficient in a particular nutrient, like vitamin D, for example, or even vitamin B12, then I'd actually rather correct that first and then do a water fast rather than try to do it while we're water fasting. And then this question is, do you do remote water fasting with children as young as 6 or 7 years old? The answer is absolutely not. If you have a child that's 6 or 7 years old and they are suffering from some health problems, my advice is to go to your either local doctor so they can examine them, or schedule a telehealth appointment with Dr. Thomas. You can do that on either fastingescape.com, just look on about Dr. Thomas, or is it drrenaethomas.com? Is that right?
You got it.
Yeah. Dr. Renae.
But yeah.
Yeah.
I should have picked a more simple website, but we can link it.
We'll link it.
So just, I did say it at the beginning, but just so everyone knows, I am fully board certified in family medicine, and part of family medicine means that you can see patients from when they're born to, unfortunately, their last day on the earth. So happy to see children, happy to chat with you about children, but water fasting in children is not something that we supervise, and something I would proceed with a lot of caution. There's a lot of things we can do before even considering fasting. Children are a lot more adaptable, and they're a lot easier to heal for most of the time, that we do not generally need to go anything near as extreme as water fasting.
Right.
And it's just while they're growing and all of those things, it's not necessary and it's harmful. So not something that we do, not something that we ever see doing in the future.
Yeah, absolutely. And a lot of times, kids will do their own little fasting process if they are sick. So they may feel like they're just not that hungry for a day, a day and a half, if they've got a raging fever, some flu, some stomach bug, whatever it is. So it'll kind of take care of itself. But as a general rule, we're not wanting to do any extended fasting. There isn't a lot of literature on how ketosis affects a growing kid, and so we're not gonna try to be the pioneers and risking that. There aren't a lot of kids that age who are having lifestyle diseases. And so where fasting gets its shine, where fasting really shines the most, is when we are dealing mostly with lifestyle related diseases of dietary excess. Okay. And some sort of imbalance. So maybe it's not dietary excess, maybe it's some sort of like Dr. Thomas mentioned earlier, endocrine disruptor from plastics or air you breathe or whatever it is causing some allergies or some asthma or some PCOS or whatever it could be. All those things also work in concert to get your body out of balance. And so this is where fasting really shines. A 6 or 7-year-old kid or even a 10-year-old kid hasn't had enough time on the earth to get in balance. And so if they're dealing with something that may be, acute, that'll resolve itself with the proper diet, with the proper medical help. And if it's something genetic, I don't think fasting will really help all that much anyway. So in general, we look at fasting. It's not a miracle. It's not magic. It's just a way that we let the body heal itself without any interference from the outside world.
But important for children is to have them on a health promoting diet. A well-planned, whole food, plant-based diet is wonderful for children. I've said it many times in many interviews, but I was raised whole food, plant-based. So I have a big, I can say at least for one person, it works wonderfully, but I know scientifically speaking, a well-planned plant-based diet is the best thing you can do for your children. Unfortunately, children these days are suffering from dietary excess, just like adults. I've seen 7, 8, 9-year-olds with type 2 diabetes and other metabolic conditions, which is extremely sad. And it's from the awful food that they are consuming and the lifestyles that they're living. So having your child on a health promoting lifestyle, whole food, plant-based diet, well planned. If you need any help with that, always happy to help out. Regularly exercising, living well, that will give your kid the best chance of living a healthy life.
Wonderful. Dr. Thomas, it's been a pleasure. It's really, really fun chatting with you. For any of our viewers, if you had some more questions, just send it over. If you're looking to schedule a consult with Dr. Thomas, I'll put the link in the description of this video once it comes out. And then if you're looking for remote fasting, I'll put the link for that as well. So great to have you, Dr. Thomas. It's a pleasure. And thanks everybody for joining us and asking some great questions.
Absolutely. My pleasure. So great. Thank you so much.
All right. Take care, everyone.
All right.